This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant or have a long-term condition. Find out if you are eligible at nhs.uk/staywell. Children up to Year 7 can get the free nasal spray at school or through their GP if they are below school age. If you are not eligible for the free vaccine, you can pay for it at your local pharmacy. The flu vaccination does not give you flu. It reduces the risk of catching flu, as well as spreading it to others. If you had the vaccination in the past, that will not protect you as the flu strain changes every year, so you need to have a new one this year. It is also important to wash your hands often with warm water and soap. Use tissues when you cough or sneeze, and bin used tissues as quickly as possible. Thank you for helping to protect yourself and loved ones this winter.
I can really recommend being a foster carer for Notts County Council. There's always someone walking the journey alongside you, whether that's other foster carers or social workers. It really helps to provide stability and consistency for children who really need it, and that's really rewarding as a foster carer.
Roger and I have been fostering for 35 years. We do deal with challenges, but to say we've been doing it for 35 years to me proves that it's not impossible. We learn an awful lot from these young people, and even now we're still learning.
As a foster family, we care, we want to make a difference, and we get so much fulfilment from fostering. The satisfaction of making a difference is something that money can't buy. Just seeing the smiles on the children's faces and helping them reach their potential is wonderful.
We work as family workers within the fostering service for Nottinghamshire County Council.
I really enjoy my work. I really enjoy meeting lots of different foster carers.
You know, we get to know the families, we get to know the kids, and we care, basically. It's important as it is to them that the kids are getting the support that they need.
A lot of people said to me they would like to be a foster carer, but there's something stopping them. I had that as well. And we decided just to jump in and do it and see what happened. And for us, it's been the best decision we've ever made.
It's been a fantastic decision, it really has, yes.
Once people start to become a foster carer and take that leap to do it, they'll understand how much it gives back, not just to the child, but how much it empowers you as well.
I'm Leon, I'm a care leaver, and I've been in care since I was 8. And I've been with the same parents since, and they're amazing. Like, they are my foster parents, but I do class them as my parents, my mum and dad. All a child wants really from a family is to be supported, loved and cared for, and know they're there because they're wanted. From personal experience, I know the difference it's made for my life.
We always say that we foster as a whole family. It's not just us who are the carers, our children are involved in that. And even now, people express concern about the effect on our birth children of foster caring. I think we need to kind of get past that and dispel that myth, because actually the overall effect on our children, I think, is positive. They're learning new skills, they're gaining empathy, they're interacting with children from different backgrounds. For a long time, we didn't make use of support care, and we wanted our child to settle into our placement and not feel pushed out, but it's actually been really helpful for us to start to have support care. We've
known Zoe for a number of years, and it's meant that we got to know her foster child. So for her, it's been like coming for a sleepover rather than a feeling she's coming to another family. I got into fostering for Notts County Council, and it was something that I've always wanted to do. But working full time and my husband also working full time, we thought it's not really going to be something we can do now. But after looking at the website, we realised there was this wonderful thing called support care that we were able to offer. It might surprise you, but actually I'm under 30. I don't have any children of my own, and that doesn't stop you from being a foster carer.
I think some people don't go into foster care because they think it's going to be really costly to have another child living in their house, but actually the fostering allowance is generous enough to cover all the costs of having a child living with you.
We have a lot of fun on the weekends when we have foster children in. We get to go to parks, ice skating, children's events, trampoline in parks like I Jump.
We get access to the Max card, which is a discount card for foster carers and their children to access different local amenities. Also recently we went on holiday and we were able to use the Max card to get free access to some castles and historical places because it's a national initiative.
We chose to go with Notts County Council because of the support care that was offered and the training. And it's always local to Nottinghamshire. My parents are foster carers for an agency and they found it really difficult to get support care for their child.
My name's Lynn. I am now a support foster carer. We were mainstream carers, but given our ages, we felt that we couldn't commit to children for long terms anymore. We just find it really rewarding, the relationships we build up with these young people, and we feel we're perhaps a bit like grandparents to them. With the children coming here for weekends, this enables their mainstream carers to have a break, and this makes things more secure perhaps for the children to continue there. I work with my supervising social worker to sort out the dates. She comes out to see us every month and it's all very relaxed. I find Robin really easy to speak to. She listens to my concerns and I value what she is saying to me in return.
The benefits of a supervising social worker are always having someone to contact. There is also emergency duty team that they can contact on a weekend and out of hours. I think the times that it gets difficult is when, she's supported a child for a long time and then they're either moving on out of area or they're moving on because they've reached the age of 18, and she has to say goodbye to that child, so that can be always emotionally draining. Generally it's staying in touch so they know that you do care about them and you are concerned, that the impact that something like that has had on them.
You do feel fully supported. It's like working in a team. We still even now go on training sessions. I almost look forward to those sessions because you meet other foster carers there and it's very interesting. I've always fostered with my husband, who's brilliant, and I feel personally I couldn't do it without him. He's super with the kids and it's just something we continue to enjoy doing. A lot of our friends feel at the ages we are, we shouldn't be doing it, but it's a way of life for us now.
I'm Mark, I'm a foster carer dad in the family. I'm the fun dad, if you like. I've tried to be anyway, try to be.
And I'm Amy, a foster carer. So we have 4 children of our own and then we foster younger children into our family. Being a foster carer is a devastating privilege. It's devastating that children have to be in this situation, and yet what a privilege that we are able to help them.
Yeah.
When you foster as a family. I think it's very important that everybody in your house is involved, and even though we have 4 children of our own, we don't find that a challenge, we find that quite an easy thing to do. Daniel particularly, he's older and he sees more and he understands more because he's older, and he feels that it's given him an insight as to when he's older and he has his own children. Whenever a placement ends, we always ask them, do you want to do it again? Would you like another child? And it's always yes. And even though we've had the sadness maybe of a child leaving, and they are sad when a child leaves, the positive that we get out of it, they get to see, as we do, the happiness when a child leaves us, and that inspires them as well to want to do it again and again and again, as well as us.
When a child leaves, it's sad for us, but it's happy for them.
The biggest thing for us has been the support network, because if it wasn't for them, I don't think we would be able to carry on. I think it's a big thing to know that there's always someone there if you've ever got problems. And for our children, they really enjoy the events that we attend. We've been quite surprised at actually the amount of events there are for
barbecues and picnics and
local supports
and Foster's Got Talent. We've been to the Christmas do's and the sons and daughters events here today are fantastic for our children. They really enjoy it, and I think it's a lovely thing for them to do.
And it's very empowering for them to know that they're appreciated as a child in a foster family.
We are allocated to new foster carers so that we can give them support and advice before they get their new placement. So we might go out and give them some advice around therapeutic parenting and kind of build up their foster carer toolkit before they begin.
Yeah, and we've got an idea of obviously the child who's being placed with them, so that we can tell them some background about that particular child.
We find that children that have experienced trauma or have attachment needs are more responsive to therapeutic parenting than your average parenting. So that's very much what we encourage our foster carers to do.
Theraplay is obviously a form of therapeutic parenting. A lot of the foster children, their early life experiences of being quite sad really. They haven't had any compliments, nobody's ever said that they've got nice eyes, nobody's said that the hair's nice. So that is something that we always start off to build their self-esteem.
Yeah, there's lots of nurturing activities, so tactile, skin to skin contact, eye contact. We'll offer nurture in positive ways, introduce it slowly, so we might do touch with a feather, maybe feather face painting.
One of the main purposes of Theraplay is for them to achieve, so we always want them to do really well. And we adapt the games depending on the age and the abilities of the children. When I go out and visit foster parents and explain what therapeutic parenting is, it's as if a light bulb just turns on in the head.
I think because we visit regularly, we go back and get the chance to go over what we talked about last week and see if they've tried it out and if it worked, and like you said, that you've had that light bulb, oh, I tried what you said and you know what, it worked.
I'm Gemma and this is my husband Paul, and we're both foster carers. I think initially we were a little bit anxious ourselves about going to panel. It sounded quite scary, but it wasn't at all. It was just a really friendly chit chat with a group of people around a table. It was more of a celebration really of us being there and of us, wanting to become foster carers. The County Council offer a fair rate of pay, so we get paid dependent on our level of experience. So after you've done it for a while, then your level of pay will go up based on your experience and level of training that you've done. We've also got a network hub, which is a foster carer support group, and it's just an informal get-together. We feel so valued as a foster carer for Nottinghamshire County Council. Everyone's so caring and wants what's best for you as a family. The matching process is really careful, so they listen to our needs and, they would never think of placing a child that wouldn't fit in our environment. As a foster family, we try and just make it everyday, normal life, try and bring some stability and love to that child that's staying with us and give them experiences that perhaps they've not experienced before. We love going out on day trips together, and for example today we've come pony trekking. Nottinghamshire's a great place to foster because we've got so much on our doorstep, there's so much that we can do. I feel really lucky that we're able to foster here.
I'm Leon, I'm a care leaver. I went into care when I was 8 for reasons of basically not being looked after properly. So I've been in care for 15 years, long time.
Thank you. Our last meeting was held on the Wednesday the 4th of November 2020. Can the minutes be approved as an accurate record of this meeting? Any matters arising, please? No, thank you. Before we list the apologies, agenda item 2, I'd like to welcome Councillor Marion Bradshaw to the membership of the Health and Wellbeing Board. Councillor Bradshaw has replaced Councillor Amanda Fisher as a representative from Mansfield District Council. We'd like to thank Councillor Fisher for her involvement and wish her best for the future. Could I ask Martin to give the apologies, please?
Thank you very much, Chairman. The apologies I've received are as follows. Melanie Brooks, Nottinghamshire County Council, who will be deputised by Sue Batty. Councillor Bosniak will be deputised by Councillor Creamer. Jonathan Gribbin will be arriving late to the meeting, so in the interim he'll be deputised by Amanda Fletcher. Lucy Dadge from NHS Nottinghamshire Clinical Commissioning Group, and Fiona Callahan, who will be deputised by Hazel Wigington. I've just received apologies from Kevin Dennis from the Police and Crime Commissioner's Office, and an indication that Leanne Munger will substitute for David Ainsworth, also of the CCG. And I've also just received apologies from Colin Pettigrew as well. Thank you, Chairman.
Thank you, Martin. Agenda item 3, declarations of interest. Do any members or officers present have any disclosable pecuniary interests or private interests, pecuniary or non-pecuniary, to declare? Could you please show now? No, thank you. Agenda item 4 is the Chair's report. It's to consider whether there are any actions required by the Health and Wellbeing Board in relation to the issues raised in my report. It's quite a long report, so I'm not prepared to go all the way through it. The first is the update on the suicide prevention funding, which I think we're going to see more of in the future. It's an issue that's quite top of people's agenda at the moment, so it's good to see we're getting more funding there. If anyone's got anything to bring up about the Chair's report, I'm happy to take questions, or we can move on to the main meeting, which is the agenda item 5. Thank you. So agenda item 5 is Nottinghamshire's Best Start Strategy 2021 to 2025. It's to consider the draft Best Start Strategy and recommend it to the Policy Committee for final approval, and to agree and receive annual updates for the Best Start Strategy. Those that attended our workshop on the 5th of February, we focused discussions on giving children the best start in life. This is one of 4 strategy ambitions for Nottinghamshire Health and Wellbeing Strategy. The workshop was attended by a range of stakeholders, including members, clinical commissioning groups, community and acute health services, as well as representatives from organisations working with children and families. These discussions have helped to inform the Best Start Strategy presented today. Irene Kakoulis, Nottinghamshire County Council's Group Manager for Early Childhood Services, will now take us through a presentation. Please consider your role in championing contributing to the delivery of this strategy, and we will have a part to play in giving the children of Nottinghamshire the best start in life. Thank you. Thank you, Irene.
Thank you very much, Chair. Yes, so you will have had the copy of the paper today and 2 appendices. One of the appendices has obviously got the draft strategy within that. So yeah, hopefully you've managed to have a look at it. So as Councillor Rostance has said, this strategy really came from the workshop that was held last February. Can't believe it was nearly a year ago, but obviously COVID then hit and things were delayed. So we apologise, it's taken nearly a year to actually get the strategy back to you. So the strategy was, the workshop was extremely useful for us because we came up with the 10 priorities for the strategy. So if you look at the committee report on item 8, we have those 10 priorities. The first one often makes people giggle, which is prospective parents are well prepared for parenthood. We often get the statement, well, how can you ever prepare for parenthood? But that is certainly something we want to be doing with schools and more in terms of relationship education and so on. Mothers and babies have positive pregnancy outcomes. We know that we have to start very early with our families. We know that attachment has got to be there, but pregnancy is an absolutely critical time. And likewise, moving on, babies and parents and carers have good early relationships. So that is about attachment, it's around boundaries. There's so many things that families are doing. Parents are engaged and participate in home learning from birth. With all of these, it's probably worth saying as well that this has come from evidence of what works and what is needed. We have spent a lot of time developing 2 joint strategic needs assessment chapters, which have looked at mapping, which have looked at evidence, and have looked at what works. So that's another thing that we considered at the workshop. So the priority there around home learning is very much based on evidence, and that's around supporting parents to do really simple things at home, not over rely on, you know, computers and gadgets and things like that, but to have those sorts of play activities they can be doing at home. There's a big priority in there around emotional, mental health and well-being, and that's especially important now during lockdown. We have seen an increase in referrals to our services around mental health for our parents. There's increased isolation. And we know that there are various reports around babies born during lockdown. So actually COVID has meant we have had this extra focus on trying to support our new parents and those that are expecting. We then move on to children and parents have good health outcomes. Now, this strategy is up to the age of 4, so it isn't just about pregnancy in that first year of life, it is longer than that. We have a priority in there around early language, speech and communication. And that is really, really important. We have a number of services in Nottinghamshire. We're very, very lucky, and that is something that we want to keep continuing. It's a standalone priority because of the importance of speech and language communication needs. We want children to be ready for nursery. We want them to be ready for school. So that is, you know, people think about basic language development as part of that. It could be that it's around toilet training. There's all sorts of things that fall into that. And children have access to high quality early years provision. And that is absolutely one of the key factors for us as well, if you're looking at evidence base. Early years provision isn't just about childcare, it's about early education, and that's certainly something that Ofsted focus on. And then the final priority was around parents being in secure employment. When we're looking at evidence and research, we know that families in lower incomes do have worse outcomes in terms of health. You will all know that in terms of the work that the board has been doing. So actually by supporting parents to be job ready, then actually that's something that will impact on the life chances of children from the youngest age. So I hope you will agree with those, and they certainly did come from the workshop. Sorry to have gone through those in detail, but I thought that's the bulk of the strategy really. The strategy itself, which is in the appendix, does break those down as well and says what we're going to do. So again, have a look at that. We have a number of organisations in Nottinghamshire who are buying into this. We're already doing a lot of the work. However, by developing the strategy, we've identified certain gaps. We've identified that there are certain partners that may be missing from the table, which is why we're also setting up a Best Start board. Now, that board will report directly into the Health and Wellbeing board, but we're still waiting for approval to set up the board, and that will be going to full council in March. So there will be some delays when we set up the Best Start board, but we have to go through the process to get it set up right, to have the right membership on there. At the moment, it's not being proposed that there are elected members around the table at the board. However, full council may decide otherwise. We wanted to have, you know, very senior engagement from CCGs, from the Healthcare Trust, from the acute services, but also, you know, heads of maternity and things like that on that group. We have a number of subgroups already in existence. We've had for some time a number of groups that meet around breastfeeding, around various other health priorities, but also educational priorities for the early years. They all need a home, and having this Best Start board means that they all report there and we can coordinate better what the strategy will deliver and how we will measure our success. So that is all within the strategy. I don't want to take up any more of your time really, so I think it's really open to the chair now if there's any questions or any items you need to discuss.
Thank you, Irene. Any questions, please, or comments? Councillor Guilfoyle. Glenn.
Thank you, Chairman, and Happy New Year to everyone. Thank you, Irene, for that. I mean, I remember the meeting, and like you say, it's time flies when you're having fun, doesn't it? Just probably for me, more than anything, I became a grandparent during the COVID period in May, and clearly some of the issues that I thought should be happening, I don't think did. And I've seen some of the issues that new parents can particularly face. And I just wondered if the support that's outlined in here is for everyone, or is it targeted? Is it another issue that I know has been an issue talking to professionals and around at the Sure Start Centre before we couldn't meet, so to speak, was the language and speech therapy, and that we did some reorganisation around that, and I know that is a particularly key service, and I just wondered where we were with that. So in one sense, I support the framework and the strategy that we've got. My concern is that the impact that COVID's had already, not just on this service, but on the paper that we've got coming later on mental health, and in reality, I want to know whether the partners are going to do some sort of quick desktop work around what that impact has meant for mothers, and what we can do to actually call it backfill, if you like to speak, backfill, and because we've, out of those 1,000 days that we sort of set it as a strategy, we've lost nearly in another couple of months, we've lost 365 of them for some
Unknown
parents.
participant is now joining.
I just wondered, what we're going to do.
Unknown participant is now exiting.
And what we're going to put into place to actually get that back, and whether we could have an early report on that particular issue.
Thank you, Glenn. Thank you, Irene.
Thank you. Yeah, congratulations, Councillor Guilfoyle. That's great news, being a grandparent. So you've experienced firsthand, really, some of the challenges that our new parents face during lockdown. It has been a real struggle. I mean, just to confirm, we've maintained very good relationships with our maternity services. We have a number of them who have carried on clinics within communities. In the north in particular, we've had an increase in maternity clinics that have been hosted in children's centre buildings, trying to keep parents away from the hospitals as such, but getting them out into the community and linking them into the children's centre service. Children's centre service has continued throughout lockdown. Yes, they've had to do things slightly differently, but now that all the buildings have all been sort of made COVID secure, they're doing a lot more. They have developed a new virtual course for new parents. They are doing lots of baby massage type work, which is very much about attachment. Some of that can be done virtually. A lot of it is being done one-to-one. We're trying to limit the number of people that come together. So there's a lot more one-to-one work happening at the moment. But there are gaps. And I think you're right, that there is some catching up to do for some of our families. Interestingly, during lockdown, we have seen, and this is anecdotal, and this is something that we want to do some more work on, in some cases, children have actually benefited from having more time with their families at home, and others haven't. And what you will sometimes see is those parents who have been working at home and hadn't had the time necessarily for their children, it's those children whose speech and language may have deteriorated, for example. Whereas others, we've seen improvements because they have had that time. It's quite bizarre. We wouldn't have necessarily thought that was going to happen. But overall, I mean, we are doing another report for Children's Committee about the impacts of COVID, but that's more around sort of poverty and income and so on. There will be lots in there around sort of the early years as well, but we will have some catching up to do, and I totally agree with that. All of our early year settings have now opened as well, so we hope that and our figures were actually really good last term. Lots and lots of our children were going back into early years provision, so they will have that as well, but there's a lot more that we need to do. In terms of the Best Start strategy, it is both universal and targeted. So this is for everyone. We want every child to have the best start. It's just that some of our interventions will then be targeted to try and reduce inequalities. So, for example, we might put on more provision in areas of greater deprivation. We may target particular cohorts. Targeting teenage parents is a big priority for us. So it's that sort of thing. So it's a balance, really. Using online information is going to be absolutely crucial for us as well. We're going to be doing a lot more around that. It's not suitable for everyone, I get that, but it's an option for people as well. Speech and language, if I just mention speech and language to you. We did go through some changes at the end of last financial year.
Yeah, thank you so much. Thanks for your help. All right, love. Thank you. Thank you. Bye-bye. Bye.
The speech and language element of the Children's Centre service has been maintained within the Healthcare Trust. Children's Centre Services moved into the County Council on the 1st of June, but the speech and language part of the work stayed with the Healthcare Trust. And actually what we are doing now is working closely with CCG's commissioners, and we are developing one single pathway for all speech and language needs. So the team that used to work in the children's centres, who delivered a programme called Home Talk, which is around identifying early language delay and supporting children very, very early, is now part of the specialist service with therapists. So there is one point of access for families who are concerned about speech and language. They will be triaged and they will get to the most appropriate service. The work we're doing with the CCGs at the moment means that from April, there will be one contract, and we are pooling our budgets to have one speech and language service contract across Nottinghamshire. The issue we have there is Bassett Law at the moment. So the Bassett Law Speech and Language Therapy team is managed by Doncaster and Bassett Law Hospital Trust, so that's slightly different. However, the links are really, really strong with the early intervention speech and language team, is what we're calling it, and that service in Bassett Law. But it is actually working really well at the moment. COVID has meant that our referrals have dipped for that speech and language service because those assessments aren't necessarily being done as frequently as we would have liked. Does that answer your question?
Yeah. No, you've done quite a bit of depth there. Thank you.
Thank you. Thank you, Irene. Thank you, Glenn. Dr. Bartholomew, please.
Thank you very much, Irene. First a comment and next is more of a query. And I agree, this is an excellent strategy. It's very comprehensive and encompassing. With regards to anyone who's wondering why giving advice before parenthood, I think that when you look at what interventions could be done to reduce health inequalities, that one of the most significant changes is what could be done before childbirth, and that's where the significant intervention. So that's just to add on as a comment. My query is, it's not necessarily a query, it's about how do we move from an excellent strategy to operationalize this to what happens at an ICP level. And I'll probably come with my own ICP hat on, because from a Mid-North's point of view, we have as a priority, one of our 5 priorities is to give every child the best start in life. And this excellent strategy has components of it which must be thread through the ICP strategies and likewise through ICS strategies, the LMS strategies which go along, and equally primary care networks with GPs and others being frontline staff, the visibility of the strategy and how things are operationalized on a ground level. So it's more about a challenge, and I can see that towards the end of that, the membership itself includes ICPs and the wider groups involved. So it's more about the practical terms of how we move from something that's a very excellent strategy to that really affects and makes that meaningful interventions for our citizens.
No, absolutely. Yeah, you're absolutely right. I mean, we're lucky actually Mid-North's that I work very closely with Lorraine on the Best Start priority in the ICP there. So that's really good. We haven't necessarily got the links like that in the other areas. So again, that could be something the board might be able to assist with. But you're absolutely right. For us, the priority at the moment is now getting the buy-in from everyone so that we all talk to each other and we work very closely together. The local maternity transformation, LMNS, will be represented on the group. We want to make sure that we're not doing things in silos. This is our opportunity to work very closely together, make sure that we are targeting the families who really do need support and are struggling, but also providing the same offer to all families. getting that buy-in is absolutely crucial. I have to be honest with you, COVID has meant that the engagement of certain partners just hasn't been as effective as we could. But you know, that's just the way it is with COVID. Of course, that's had to be priority. So as time goes on, I think we will be getting better engagement. We will all have a role to play in this, and we certainly all need to champion why it is so important that we target very early preconception up to the age of 4. But yes, its influence and its roots into things that we can influence would be very, very useful, which is another reason we want to report to the Health and Wellbeing Board. We've got the right people around the table to be able to help open doors. We'll be able to identify gaps and come up with suggestions for things to improve the way we're working at the moment. At the moment, I think our challenge is that we have been working in silos for a while. I actually think COVID has started to reduce those silos. We're all having to work together a lot more. So actually the benefit of that is hopefully that relationship will carry on for the Best Start strategy as well.
Thank you, Irene. Dr. Griffiths, please.
Thank you, Irene. And again, I support your strong strategy. One of the things I'd like to just raise with you is about the principles that underpin the partnership work. And one of the things that you mentioned there is around, we talk about clear leadership, partnership working, co-production with families, evidence-based, family-based approaches. And then we talk about effective information sharing to better identifying emerging need. I think that's absolutely crucial. And I just wonder whether actually it shouldn't be a principle, it should be more of an ambition. I just wonder whether actually the ambition for Nottingham should be that children and parents have systems around them that actually mean that information is shared in the most optimized way possible, and actually it's more visible. I think there is a danger with certain principles, is that they're just accepted that people will share information, and actually there isn't any ambition with it. Now I think leadership and accountability are de facto, yes, we want to improve them all the time. Partnership working, as you rightly say, is important and has been challenged by COVID, but maybe good will come of what's happened with COVID, because we are seeing different conversations. I do think, though, that effective information sharing can be measured, and we can actually look at how information is shared between local authority and primary care. We use lots of different siloed information systems. How are they going to talk to each other? How is information going to be improved? Because our patients, our clients are what falls through the gaps. And I would like to see that more as an ambition as opposed to a principle.
Thank you. Yes, we can certainly change that. I mean, this is still a draft strategy. Before it goes to policy committee, we can certainly change that into an ambition. And I think you're right. I think the appetite is often there for information sharing. We talk about it and don't necessarily do it. We have had some real successes in the last sort of probably a year and a half, 2 years, in terms of getting information sharing agreements written out. We know exactly what and how we can share things about particular families, any concerns that we may have. However, it's not across the board. It's between one organisation and another. It isn't covering everything that we need. I think, if I remember correctly, there was an information sharing agreement for Nottinghamshire County Council and all the CCGs, but that was a while ago. That was back in the day when there was a lot of CCGs. So whether that needs to be looked at again, I don't know, but that's certainly something we can look at. I think that's a very valid point.
Thank you, Irene. I think you're right there. I think you're right, Jeremy. I don't think we do a good job of it anyway. It's something that's been raised for many years now, the information sharing. So it does need to be bolstered. Susan, please. Susan Shaw.
Thanks a lot. Oh, sorry I was late to the meeting. I hope you haven't answered this, Irene. Hi. I was looking at it. It's really robust. There's a couple of questions. The page that you've included about recognising the impact of COVID-19 and what you've just articulated about people probably haven't. It's not been front and central because of the situation. However, we know that it's impacting more for children and families and domestic abuse and all the rest of it. And I'm just wondering if COVID goes on for another year. I mean, it's going on for a long time. How quickly will you be in a position to kickstart some of this excellent work? If you know, it'll have been done a bit. I mean, there's another report after yours about mental health, which is really important because presumably it links together. And I'm just, because we've been going to meetings for 9 months now where we can't do anything because of COVID. Well, it's becoming to be a bit freaky now that, we've just got to address it. Otherwise, those young people and children that have got crisis will have even more crisis. And then just one more question before you answer that. I'm just looking at the actions 1 to whatever, and the only time you've mentioned carers is in number 3, babies, parents, and carers, and in the report it's not, carers don't feature other than where you've headlined babies and parents and carers have good early relationships, and everything after that is parents, and that right through the report it's parents. So I just wonder if why that would be, given the fact that carers are not just for children looked after, obviously, but for carers in multiple ways look after babies and children. So I'm just interested in that, please. Thank you.
I'll take your second point first, Councillor Shaw. Yeah, you're absolutely right. I mean, the first two are very much about sort of the physical pregnancy, giving birth and antenatal outcomes and so on. But certainly the others do need to say parents and carers. So again, as I've said, it's a draft strategy, so we can add that. That's a simple thing for us to do. But yeah, well spotted. And in terms really of COVID and moving the work on, there is a particular piece of work happening at the moment about new parents and around trying to tackle isolation. That work is getting bigger and bigger as time goes on. We are working very closely with the registrars in the county council to pick up any new births of families who aren't necessarily engaged, referring them into children's centre services, signposting them to healthy family teams and so on. We do have a number of little working groups together where we are trying to set up particular packages of support, trying to make sure that we have links with all the different maternity teams as well, so that once somebody has had a baby, we know exactly that family needs support and we can pick that up. I don't think COVID is, I think originally when COVID first hit, things were extremely challenging. I know certainly in the acute trusts at the moment, things are very, very busy. Engaging I'll just give it maternity services as an example. I'm not saying that they're not engaging, but it's hard for them to come and attend board meetings while they've got, trying to manage crises actually in their setting at the moment. So it is a bit of a challenge. However, it doesn't stop us having those conversations, having those phone calls, sending information out. The majority of our partners are all working towards this at the moment. It's just not very joined up. So I would assume that after full council agrees the development of the Best Start board, that we will have a very early board meeting to scope what it is that we can do realistically now and what is an ambition for later on this year. We do have to be realistic about it, but I must reassure you that there is a lot of work happening at the moment. We've got some brilliant early years settings as well who are offering a lot of support. There are organisations out there at the moment going the extra mile, not just delivering what it is they should be. They see that need and they're being proactive about it. But I appreciate there will be some delays for some of our partners.
Thanks very much. Thank you.
Thank you, Irene. We've got no further questions, so I think it's an excellent piece of work you've done. And I think Irene will take on board the comments made. If we can go through the recommendations, please, so that we can consider the draft and recommend to policy that this goes through, obviously with the alterations that you've taken on board today, Irene. So if we can agree, any objections to that, please. No, thank you again, Irene. Excellent piece of work. Thank you very much indeed.
Thank you.
So we move on to agenda item 6, the Joint Strategic Needs Assessment, chapter on emotional and mental health and children and young people. Rachel Clark, Programme Lead, Children and Young People's Mental Health, will provide an overview of this item. This will include a brief presentation summarising the chapter, covering its key findings, recommendations and any current unmet needs. In line with the recommendation of the report, we will then be asked to approve the JSNA chapter on emotional, mental health and children and young people. Can I call upon Rachel Clark, please? Thank you, Rachel.
Yes. Has everybody got sight of the presentation on the screen? Can you see it?
Yes.
Yep.
Yes. Thank you. Oh, well, thank you for giving me this opportunity to talk about this chapter today. As you can imagine, with such a big issue as the emotional and mental health of children and young people, it's quite a long chapter. So what I'm going to attempt to do today is just give you a flavour of some of the key points, and then we can move on to questions. So the first thing I wanted to look at is what do we know already about children and young people's mental health? As I'm sure all of you are aware, good mental and emotional health and well-being is really crucial for the healthy development of children and young people, and helps them not only in their childhood, but also to become adults who can live fulfilling lives and participate in society. And one of the things that we have included in the chapter is a definition of mental health and what good mental health is. And we've used something from the World Health Organization, which I think is very helpful in thinking about mental well-being as not just being an absence of a mental health disorder, but being a state of well-being in which an individual realises their own potential, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her or their community. And I think this is really helpful in terms of us thinking about good mental well-being, not just about having diagnosable mental health disorders that need to be treated, but as something that has numerous things that impact on it, and there's lots of people who can contribute it to us, and it stops us from going down that all routes lead to CAMS approach that we can sometimes take when we're thinking about this. One of the useful things to highlight here as well is that half of all long-term adult mental health disorders are established by the age of 14 and 3/4 by the age of 24, and that has huge impacts. So I think that really does make a strong case for...
Excuse me, Rachel, I'm sorry to interrupt you. It's Martin, the clerk to the board. The chair's requested that you put the presentation into the sort of slide view.
Sorry.
To see it easier that way.
Sorry about that. Right. Is that better?
That looks better to me. Thank you very much. Sorry to interrupt.
No, that's okay. I'm sorry about that. I hadn't realised that was there. Can everybody see that okay? Good. Well, I'll continue then. What we also know is that children are at a higher risk of developing mental illness if they experience adverse events in their lives. And so whilst we recognise that any child or young person can develop a mental health issue regardless of their background, social and health inequalities are associated with this increased risk of developing mental health issues, and that could be things around being looked after by the local authority, illness or disability, or some of the other things that are outlined on the slide here. I've also highlighted some of the statistics, and these are taken from the Mental Health of Children and Young People in England survey, which was published in 2017. And we can see that nationally there's been a gradual rise in the number of children and young people with a mental health disorder over in the last decade. So that in 2017, 1 in 8 5 to 19-year-olds had at least one mental health disorder, and that was compared to 1 in 10 in 2014. And as a result of COVID, we are expecting to see an increase. A couple of things to highlight. Females aged between 17 to 19 were more than twice as likely as boys to have a mental health disorder, and this was largely around emotional disorders. And LGBTQ plus children and young people were also more likely to have a mental health disorder than those who identified as heterosexual. In Nottinghamshire, we've estimated, using these national figures, that approximately 17,000 children have a diagnosable mental health disorder, and that approximately 7,500 of them have sought formal help and support. However, what we do know is that many more will be seeking support through the use of informal networks and through charity and voluntary services. And we do think that we mustn't discount this use of informal networks or see it perhaps as something lesser. We have done quite a lot of work with young people in Nottinghamshire to get their views and their experiences of mental health and what helps them. And one of the things that they have told us is that they really value these informal networks, which includes parents, carers, friends, people in their community. And they do want a lot more support for those people, particularly parents and carers, in understanding mental health issues so they can get the support they need within their families. Within Nottinghamshire already, whilst there's plenty more work to be done, we have developed strong evidence-based strategies, and particularly through improving access to mental health services. One of those things was introducing a policy of self-referrals, which has been very effective. And also we've developed robust pathways around perinatal mental health. And we've also rolled out our mental health support teams in schools, and we now have coverage in all localities in Nottinghamshire. There have been pilot projects in the eating disorder service and within the youth justice cohort. There's also been a significant investment in workforce, and that's not only those working in child and adolescent mental health, but in quite a range of different public sector roles. And in addition to this, schools have also made a really concerted effort to build resilience. And there is lots of good evidence that shows that school-based interventions around children and young people's mental health can be a really cost-effective investment. I did think it was worth highlighting within the chapter the impact of social media on children and young people's mental health, because I know that this is a big subject for debate at the moment. And when we looked at the evidence, the impact of social media is still unclear, and there is quite limited evidence around it. So you can see some studies which will highlight a negative impact. However, there will be others who will find no impact at all, or in some cases will find that there was a positive impact. And certainly that's supported again by the work that we've done with children and young people in Nottinghamshire, where we've asked them about social media usage. Some have found it not helpful to their mental health, but there have been others who have told us quite clearly that actually they find it a really good way to access that informal support, and also that they'd like to see much more information and guidance about more mainstream mental health services via social media. And linked to that is digital interventions. And of course, that's moved much more up the priority scale because of the COVID impact. Now, we know that digital interventions have this enormous potential to improve the uptake and the accessibility of mental health interventions, but there is still further research that's needed to establish the efficacy of those approaches. And again, in Nottinghamshire, that work has started. Some local young people have already taken part in some NHS England regional work, looking at the use of digital interventions during COVID and how effective that's been. And there has also been a questionnaire circulated to young people across Nottinghamshire about their views around digital interventions for mental health and what they'd like to see in the future. And we hope to do a lot more in this area as we go forward. So if we think about the unmet needs, during the COVID lockdown period between March and June, there was a significant reduction in referrals to mental health services. This was partly due to school closures and restrictions on GP services, but also related to face-to-face work ceasing for all but the most vulnerable. Now, all our services, since the lockdown was lifted in June, have made a concerted effort to resume some of that face-to-face work. So it'll be interesting to see what the impacts of this lockdown that we have now is. Referrals have increased a lot since then, but we still do need to do further work to understand the impact of the reduction on referrals around children and young people's mental health and the impact of the reduction in face-to-face services. We still don't know the precise prevalence of mental health and wellbeing in Nottinghamshire. However, since April 2018, all NHS Commission providers have been developing their systems to be able to provide service level data to the mental health services data set. So we hope that combined with national prevalence data that we receive will put us in a better position to understand that local need and develop services further. I've highlighted a couple of unmet needs that have come up in other chapters, the 1001 days, JSNA and Irene's talked about this in her presentation, that we need to better identify and support women with mild to moderate mental health needs and those parent-infant interaction difficulties. And also there is a gap around people of all ages who self-harm, who are at risk of self-harm, but don't meet the acceptance criteria for clinical mental health services. There have been some reductions in funding to early intervention services across the system, which have resulted in some reduction of universal provision and of parenting support, particularly around the skills they need to help support the positive and emotional mental health of their children. And whilst we've made some progress around transition from young people's to adult services, there are still issues there, and we do need to be looking at this in terms of thinking about children and young people services, not just 5 to 18, but thinking about them 0 to 25. So we're developing these really seamless services, and the age of a child or young person becomes less important, and it's more about what that child or young person needs. We still need to put more emphasis on targeting the inequalities seen in mental health and well-being, particularly for the groups listed there. And that's become more important than ever with the onset of COVID, because we know that that's had a greater impact on areas with high disadvantage. Again, whilst there's been a huge amount of work that's gone on around schools in mental health, there are still gaps around mental health support for children and young people in schools. We've had significant additional investment in the mental health support teams for schools, but the national ambition for the rollout is 25% of schools by 23-24. So this does mean that there will be a significant number of schools in Nottinghamshire who will not have access to these teams. And there's a series of recommendations there. There was just one or two that I wanted to highlight to you. The first was around commissioning in a multi-agency way, in an integrated multi-agency way, ensuring that the services meet the needs of the 0 to 25 age group. And I think the big implication of this is there's going to need to be much greater working, not just between adult and children mental health services, but between adult and children services across the board. So again, as I've said, that we're thinking rather than 0 to 18, 0 to 25. We also need to think, if we then move on to the next slide, embedding that whole family approach to tackling children and young people's mental health, including that qualitative work with parents. As I mentioned earlier, young people are really, really keen for us to support their parents so they can support them. And I think it's also about thinking that children and young people don't exist as islands. They work within a system, and parents and carers are a really important part of that system, as are schools. The other couple to draw your attention to are also 10 and 11. So 10 is around that work with schools and wider partners. So schools are that really key plank of that early intervention around mental health, and focusing that really strategically on where the level of need is and where the risk factors are most prevalent, and ensuring that all the learning that we're getting from the mental health support teams can be shared out across the system, but also that schools have access to a whole suite of services that they can then tap into. And finally, in 11, we do still need to undertake further and continuous work to understand the impact of COVID-19 on children and young people's mental health and identify steps to address this. And I suppose part of the context of thinking about this is, yes, undoubtedly, because of the pandemic, we will see an increase in mental health difficulties in children and young people. But at the same time, we need to be really careful to differentiate what is a normal response to a highly abnormal situation with the pandemic, and where people have actually developed mental disorders, because what we don't want to do is label a whole generation of children and young people as having mental illness, when in fact the way they're reacting to things is actually probably quite normal in this context of the times that we're facing. So that's the end of my presentation. Thank you for your attention, and I'll open it up for any questions now.
Thank you very much indeed, Rachel. Councillor Susan Shaw.
think it was Henry first, but if that's all right, Henry, I'll go. Thank you so much for your presentation, Rachel. I'm really interested in all this. I have got a number of questions actually, so I hope you don't mind. I was just thinking about the schools, because in your main report it talks about schools and the importance of schools, and you've articulated that amazingly well today. But when in the report it's when it says about 25% of schools and about the funding, and one of my questions was, before you'd said that, was how many schools is this in already in Nottinghamshire? Do you know that? But then if the target is only 20%, 25% by whatever date you said, that's 75% not got this service, which you have articulated is absolutely crucial for young people. And I was just wondering whether when I was doing youth work, I knew about youth services complementing some of the services going into schools, and that's probably what Henry's going to say. So I'm sorry if I've said something that he's going to say, and I'm sure he'll articulate that himself. But the other thing is, when I look at some of the tables at the self-harm, and you've brought that up as a really important thing, like in the numbers, only 6 on the page 22, table 7, it says the CAMS self-harm only got 6 numbers. That's just like so tiny. And I just want to finish off by the recommendations. You've outlined all the unmet need. Do you think we should be absolutely making sure when we sign this off today that the unmet need responses in your presentation are embedded in these 12 recommendations? Because I feel like if we don't, you've said about funding for universal services that aren't as good as they should be, and I was wondering about how frustrated you are about some of the financial implications to that. I have got more questions, but I better leave it to other people actually.
Right. Thank you very much for that. I'll start off with answering your question around the mental health support teams in schools. Yes, we have got the funding just for the 25% at the moment, which will take us through to 23-24, and that funding comes from NHS England. However, this is at the moment, this is work that's being piloted and tested out, and we're hoping that if we can evidence the success of the mental health support teams in schools, then we can really evidence their success, and they can become much more of a mainstream provision, and that we would hope that beyond 2024 we would see continued funding for these schools, although we can't guarantee it for these teams, and we'd see them become much more part of the general mental health provision landscape, and so that's why we're trying to make such a success of them in Nottinghamshire, really, so we can really prove their worth, and I think that's what's happening at the moment. I also think even if schools aren't covered by the mental health support teams, there's certain things in terms of good practice, in terms of developing designated mental health lead roles in schools, these networks that all schools can benefit from. And there's various bits of those practice. I know, for example, there's been some more money come from the Department of Education to do wellbeing in education return mental health work with schools. And some of the good practice from the mental health support teams has been shared out with other schools. So we can look at doing that. And then you also talked about the unmet needs. I think the unmet needs, again, it is really important that when we're thinking about how we're going to support children and young people's mental health, I think your point about the universal provision and the parenting provision links to that. That we can't just think about providing direct services to children and young people. We need to think about their whole families. But I do recognise that we have a limited financial envelope as well. So I think it's just about groups such as this, and when we're planning our services, making sure that we are thinking about children and young people and the fact that they do live in families, and what we can do to support the whole family around children and young people's mental health. And then you did ask another question about the self-harm stats. I can go away and check them again and make sure that those figures are absolutely correct, because what we do know is that our services do a lot of work around self-harm, and that is a CAMS service, and then there's a lot of work going on in the voluntary sector as well. So I will go away and look at that again. Does that answer all your questions, Councillor Shaw?
Yeah, it does. Thank you very much. I'm really, if you can have a look at that, number 6 is definitely, it's got to be wrong. And there was just one last thing about children looked after within the 12 recommendations. I wonder whether they should be sort of front and central in the recommendations, because they've got a couple of paragraphs on them in your appendix, but and very importantly, it says in there just how it affects their life, being, you know, through their emotional well-being. So I just wondered whether it should be probably included in the recommendations, something about children looked after, but that's just an additional thing to highlight. Thank you very much for your time.
Yeah, I think some of that may be captured by some of the work we were talking about doing the recommendation 1 around addressing inequalities, but I do take your point. Is we can look again as to whether we would have a specific recommendation around LAC children, because as you say, they are particularly vulnerable. Thank you.
Thanks for your time. Thank you.
Sorry to interrupt, Chair, but Rachel, could you unshare your screen? You might be able to see.
I'm sorry.
Members a
sorry.
bit better. Sorry.
Yeah,
Sorry.
I've only been using Teams for 9 months, so I don't really know what I'm doing.
Sorry, Councillor Wheeler. Henry.
Yeah, you've already answered quite a few of the questions I was going to ask, but what I'm going to discuss now is a bit of an insight on what's been happening with children over the last 10 months roughly. I've worked in school throughout that period and within the youth service throughout that period, and I've been in school during the lockdown. I'm in school now, apart from this meeting, obviously. I would be in school normally during the lockdown working with vulnerable key worker children. But the picture's quite mixed, because for some children, the health, their emotional health has actually improved, whereas for others, it's been a significant deterioration depending on the situation, because some children have school phobias, and are very anxious about exams, very anxious about the amount of work they're doing, very anxious about the pressure that's put on them by some of the issues within the education system. Whereas others, obviously, they're really missing their friends, missing their peer groups, missing their social interaction, all those sort of things. So the picture's quite mixed. One of the things that schools do use, I know it's in this report somewhere, is ELSA, which is the emotional literacy side of things. But that's limited by the amount of staff that are available in schools to provide that support. And one of my questions really relates to the ELSA training, in terms of how can that training be rolled out more efficiently to include more staff within schools so they can do more of that sort of work. Because I'm finding that with the ELSA side of things, a lot of that work tends to be with the key stage, within the secondary side, certainly with the key stage 3 and key stage 4, but not necessarily with post 16. And there is a gap between, there's quite a gap when the young people are leaving school. I know there's counselling services at base 51, but obviously a lot of young people haven't been able to access those services. So another question is, for post-16, a lot of the post-16 children and young people won't want to access COOF, which is an online service that a lot of the younger young people use. And I'm wondering what kind of resources available for those children and young people that are sort of post-16, that are in that transition between childhood and adulthood. What sort of resources are there for them to access during this really difficult time during this pandemic, not being able to do face-to-face, or not being able to, because obviously for space 51, for example, you self-referral. So what's in place for those young people at that difficult stage, at that difficult age, moving forward? So two things there. The ELSA training, what can be done to expand that? Because I know it's not in all schools, it's in some schools, but not all of them. And secondly, how can we ensure that young people post-16 are accessing mental health services that they can't currently access? And within that also, I'm going to bring adults into this as well, because I know certainly from the experiences I've had with the school profession, there was an awful lot of staff whose well-being, mental health well-being, has been impacted massively by the pandemic, particularly during the last term, and because of the way they've had to deal with it. But also, it's had a massive impact on the children that they're working with, because during the pandemic, there were occasions when there were children having to be sent home to self-isolate after being in contact with one of their peers, and that led to huge disruption during that term, during the autumn term. Some children had to isolate more than once. Some of them were isolated up to two times during that term, because they'd come back, be in their bubble, year group bubble, only to find that another person had caught COVID, so they'd have to go off again for a further 14 or 10 days, obviously. And that had a huge impact on a lot of young people in terms of their emotional well-being, because they didn't know whether they were coming or going. Yes, they had the online resources, they had online learning and all those sort of things, but there are also issues with young people not being able to access online learning because of issues around, and I know that there's been a push around ensuring that there's availability of online, further data, for example, for internet access, but that hasn't always been the case, and so a lot of young people haven't always accessed education online, and I'm wondering what we can do to help those young people, particularly with their social and emotional well-being, to be able to access online resources which allow them then to interact with their peers, more generally speaking. So they're my questions. I could go on, but I won't. So I'll just leave it to that for now. Thank you.
Thank you, Henry.
Yeah, I think that's a good example of what a broad area this is and how many things we could be thinking about. If I pick up first, I think you mentioned staff well-being as well, didn't you? And staff well-being in schools. Yeah. This is something, particularly from the work of the mental health support teams in schools, that is top of their agenda. And I think it does relate to the fact that I was talking about children living in this system. Well, parents are part of that, but so are teachers. And we recognise that if teachers are not in a good place themselves, it's going to impact on their ability to support their children and young people. So during the pandemic, the mental health support teams have delivered virtual workshops around staff's own well-being. We're now talking to our adult IAP providers and have got them on mental health support team steering groups to look at how we can link better with them about what they might directly provide to staff. And staff well-being is a really important part of the mental health support team's core offer. So there's that there. And I also know that colleagues in educational psychology and wider education services are very much focused on that staff well-being and are providing that support. But that's something that we'll continue to do because we recognise that teachers are absolutely crucial there. In terms of giving young people, I think you were talking something about post 16, but also how children and young people might be able to access resources not face to face but more virtually. We have got some funding now from the Department of Education, and we are working with partners across the board now to produce, a bit like we have for Children with SEND and for Looked After Children, a local offer around children and young people's mental health, and that should be finished by the beginning of April this year. And on there, if what we've envisaged happens, young people will be able to access all kinds of information about where they can get support, but there'll be also lots of self-help tools for them there, lots of things that they can look at, and that will link to the Health for Teens and Health for Kids websites that we've got there already. So we're already looking at how we can build up that suite of online support. And I think the other thing that you related to about how they get support day to day, we are looking at how we can develop within schools. I think quite a few schools are doing this virtual peer support models and things, and how they can carry on talking to each other. And again, I think some of it comes back to social media as well, you know, that it is often young people's preferred way of communicating. So we're trying to get a bit more savvy with these social media platforms now, and thinking about how we can get more positive messages around mental health out there and make people aware of what it is that they can access, because we do still get young people telling us now they don't know where to go for support. So, you know, we're really keen to look at that. You talked about post 16 again. Yes, that is a really important age, and when we look at the prevalence stats, we can see mental health needs increasing. Again, sorry to sound like a stuck record. If we come back to the mental health support teams, they're not just for schools. They also look at colleges as well, and we are doing work at how we can link with colleges. What I am aware is certainly within West Notts College, they have their own dedicated mental health lead role in there. And I think they're pioneering some really interesting approaches to young people's mental health, and they're really passionate about it. And I think there is a lot of good work that already exists in colleges, but we can build on that as well. You mentioned Cooth, that people can access. All our CAM services are available up to age 18, and then beyond that, people can access adult services. But we have highlighted within the document that transition is not great, as you said, and we are looking at that, but in the context of developing a 0 to 25 offer. So I would like to think that if we achieve what we want to achieve over the next 5 years or so, people, I mean, of course, young people are noticed at 16 because there's all kinds of other things going on. But in terms of services, they shouldn't be noticing that. It should be a much more seamless view. And also, we would hope that if we're getting things right when people are younger, and we're putting in place these early intervention services that are so key, we'll see fewer people presenting with those needs as they are getting older. They'll be moving into adulthood, feeling more mentally well, or at least with a toolkit of things that they can use to support their own mental health. And the final thing that you asked about is ELSAs. And I can talk to my colleagues in the educational psychology service about that, because I know that they've been rolling that out. And we do have a children and young people's mental health executive group that meets as well. So I'm happy to put that on the agenda about this, that it's been noted at the board that this is a good development, and what can we do, what resource can we look for to support this further. Does that answer your questions?
Yes, thank you very much. Thank you.
Thank you, Rachel, and thank you, Henry, for the question. Sarah.
Thank you, Chair. Hi, Rachel. Yes, a very comprehensive and very large scope for a JSNA chapter, and obviously one that will, no doubt by its scale, have quite a lot of areas that maybe could have more inclusion. Some of the things that I would like to highlight for myself in the chapter is that I feel that there's sort of a lack of understanding or mention around trauma and early childhood experiences such as childhood sexual abuse and domestic abuse. And I think there's something there around how that could be strengthened within the chapter. I think we've got a problem with young carers in that we only really have Mansfield and Ashfield covered by the Carers Trust, who've got a particular service for young carers. And this links to some of the digital support that we've mentioned is something that young people naturally gravitate to. Obviously, the young carers service in the city of Nottingham has developed quite a lot of useful tools, and it may be useful for us to really expand our investigation, if you like, to talk to the voluntary sector in more detail. I think throughout the report, I think the voluntary sector is very scarcely mentioned. And I do think that it would be useful in the recommendations to add in some of the voluntary sector services as being very important in the development of some of the recommendations. So, for instance, the one on carers only mentions the local authority children's services, and I think we need to involve the voluntary sector partners in that. And also where you've just mentioned in Councillor Wheeler's questions around schools and colleges, I think there's a huge part for them to play in terms of these recommendations and being able to support them. I've shared in the chat a report that Healthwatch published in September, which is around young people and self-harm. Oh, yeah. Obviously, there's a self-harm JSNA, but I think in the context of this particular chapter, we do need to concentrate put something in there which is around children and young people's self-harm as a significant factor and in terms of what's there. And there's some helpful recommendations in Health Watch's report, which I think might be useful for you to include. Let me think. And the last one for me is around vulnerable children and young people and those priority groups. I think in the last section, which is about the gaps, I do think, again, we need to work more closely with the voluntary and community sector to identify parents and carers within the minority community, and also how to support people within minority communities to understand mental health better. I think there's, as I say, it's a huge chapter with so many different areas to it, but I think for me, in order to approve the recommendations, I would like to ensure that we've got partners correctly sort of, I know within the leads that might be the lead, but I think we do need to take on board some of the experience in the voluntary and community sector, which is, as you say, those informal networks are being proven to be where people go first, children and young people go first. And within that, I think we need to understand what's available within those informal networks and digital options in more detail. So yeah, that there wasn't necessarily a question, but I am quite interested in terms of where trauma isn't really being named within the chapter. I think it's sort of implied, but not very specifically. And I think there's becoming more and more understanding of the impact of trauma, especially in early childhood, and the impact that you said at the beginning, you know, our mental health is set from the age of 14 in many cases, and the issues that happen to us as children can impact us for the rest of our lives. So I would like us to understand a bit more about the impact of early childhood trauma and to use that term. I think it's something that we need to start to use more fluidly in speaking about the experiences of children and young people in our community. Thanks, Rachel.
Thank you. Thank you.
Sarah.
Yeah, I can certainly take those points on board. I think in terms of domestic abuse, I did look at the domestic abuse JSNA chapter, and I think there is quite a bit of reference to children and young people's mental health, but certainly a more explicit reference to childhood trauma. I thought I'd pick that up through some of the reference to ACEs, but clearly I haven't, and so I'll go away and look at that again. There is a recommendation around young carers, but as you say, it needs to make more explicit reference to the voluntary sector. And again, thanks for flagging that Health Watch report, that it is really important, and so I can go away and look at that, and then generally, as you say, look at the chapter and how the voluntary sector is referenced in that. Thank you
very much. Thank you, Rachel.
Thank you, Rachel. Jeremy.
Oh, I can't. I think your mic's turned off.
You're muted, Jeremy.
So, sorry, really important. Certainly from a clinician perspective, something that we see on a almost daily basis, emotional difficulties and mental health issues with young people. So I thoroughly support what you're trying to achieve. A few comments. I would like us to see improvement in education around sleep in schools. I would actually like us to actually make that as a point. I don't think that there is increasing knowledge about the importance of sleep. I think it's always accepted that it's something that human beings do for a third of our lives, but actually we never really put enough emphasis on it in terms of the impact that losing sleep has on emotional management and decision making. We talked a little bit before about social media usage. As you say, there are different sides to the coin. There's no doubt that the young adolescent that is on their telephone stroke computer to all hours of them every morning, and then he's struggling with the schooling the next day, is going to struggle with decision making. So there is something about a positive a positive decision to actually look at how are young people educated about sleep. And I don't see that referenced anywhere, and I think it is something that we could do as an additional action. And I think there's also something there about, generally about training teachers, training parents about sleep as well. So that's point number one. I think there is something as well about, particularly with young ladies, and I do speak as a parent of two, about perfectionism and comparisons with other people. Now, how you actually look at that, but there is something about, as part of any sort of resilience training, how you actually start to educate people about issues around self-esteem. I'm sure there's an awful lot of work that does go on out there, but there is something around perfectionism which I think maybe there needs to be more focus on. From a services perspective, I think there needs to be a better transition between CAMHS and healthy families. We certainly see from a clinical perspective that if we pass a referral on to CAMHS, it gets sent back to us, as opposed to us starting to integrate our services and actually say, well, we need a single transition point so that people go into the service. If it's not appropriate for CAMHS, it automatically goes across to healthy families, because there's so much delay that takes place because of this. So I would urge you to look at that transition point. I think as well, it would be helpful if there was improved training for clinicians around the identification of hyperactivity and autism as well. There are new services that are available, particularly in the south. There's always been services within the city, but there's been a paucity of services within the south. And I think as a result of that, I think southern, I can't necessarily back this up with facts, but I think if you're not used to using services, you don't necessarily go looking for cases. And I think there is something now that we are starting to have improved services across Nottinghamshire for ADHD and autism, that we actually match that with at least providing resources around training as well. And just to reiterate the points that have been made by some of the other members of the group around the transition, brain development, adult patterns of brain, neural patterns don't really establish till 25. Adulthood doesn't start at 18 years of age, and young people are still developing very much until that mid-20s point. I would like there to be not necessarily just discussion between CAMHS and adult services, but maybe CAMHS, adult services and IAPT. And as opposed to adult, but IAPT being something that patients have to seek out, that they're actually positively included in transition discussions. Because I think then we can go back to the young people and actually say that there has been a discussion that's taken place about them, and these are the menu of options that are available, and there are people out there who will understand what your problem is. Not that you're having to introduce yourself to an IAP provider who sits at the end of a phone and you don't know what, and you don't know anything about them. So I think there are things that we can do to refine it, but yeah, more power to you.
Thank you. Thank you. I'm thinking about some of the points that you've raised that I think are very valid and really important, you know, particularly around the sleep and the self-esteem and the transition and the improved training around ADHD and autism. And I'm wondering whether, rather than reflecting them in this particular chapter, whether these are pieces of work that can be picked up via the Children and Young People's Mental Health Exec. And we're also refreshing our local transformation plan for children and young people's mental health. And I wonder if some of these things that you flagged here could be actions that we could include as part of that plan.
Hope so.
Yes. No, they're great. They're good points and they're things that we need to reflect. But I'm just trying to think of the best way that we can reflect them.
Thank you, Rachel. I don't think any of these points need to be, fall by the wayside. I think all the points that's been raised today are very valid points and,
yes, they are.
need addressing. So I would hate to think that they would fall by the wayside. And if we can't include them in this chapter, it needs including in this, because it's a very, very important issue we're dealing with. So.
Yeah, and I think I've tried to think of different places it could go to, because I agree they are very important, but thinking about where we could tackle them best.
Thank you, Rachel. Councillor Guilfoyle. Glenn.
Thank you. Yes, sorry, I was trying to switch on. Thank you for that. I just want to support Dr. Griffiths on what he's just said, in particular, in reality about transition. Transition's been a concern for me for at least, and we've raised it in this committee, it must be 2 years at least, that gap within the transition and the problems that causes. And for me, I would like to see an early report back on what we are doing to close that gap and make sure that there is a smooth transition for people, because it undoubtedly there are still problems with that, and time is moving on, and we've heard already where people are sort of saying, well, we've had COVID and we've got this and got that, and I accept all that, but there are some things that we can't allow to go by the wayside. So I'd like to see something relative to this to come back very early, even if it's only and a time scale. I know strategy and which is what we're dealing with on both the reports of that is about strategy, but I would like to see something come back early that actually gives us some time scales that we can actually pin people down to say, well, that's got to be done by that date, and we need that to be done, and then that and unfortunately whatever gets, it's the old saying, isn't it, whatever you've got a target for gets done. And if we don't set those particular targets and aims, then sometimes they get left by the wayside. And this is too important an agenda on both the issues what we've been talking about today, too important agendas to let go by the wayside.
Absolutely. Yes, I completely agree. And as you said, you made the point about targets. We do have this definite target within the NHS long-term plan that we have to develop these services for 0 to 25, and transition is a really important part of that. So that is a piece of work that we are looking at and have been looking at for a number of years now. I appreciate some of the points you're making. There's a lot of more work to do, but it is happening and it will continue to happen, and we are being measured against progress around that.
Thank you, Rachel. I think we need to ensure that these are brought back, Glenn. The points that Susan's raised and Henry and Jeremy and Sarah have all raised are all quite critical points that need bringing back to and ensure that these are being reacted to, because they are quite valid points. Even if we can't include them in the chapter, I can see where you're coming from, Rachel, but we do need to ensure that these points are addressed and worked on. So if we can get something brought back to the board and to see where we are with it, Glenn, I think that's an excellent idea.
Yeah, I mean, I think, we probably will have an opportunity to do that fairly soon, in that we are refreshing our local transformation plan for children and young people's mental health, and the first draft of that has to be ready by the end of this month. So a lot of the points that have been picked up as part of that discussion can be reflected in that. And we also do want the Health and Wellbeing Board. I mean, one of the things that I'm really pleased to see today is that there's so much interest and passion about children and young people's mental health, and people really do care about it. So, you know, I'd be happy to bring back our, you know, our local transformation plan, and I hope you'd be able to see then how some of these points that you raised will be reflected in that, or there may be other methods that we can do it. But certainly keeping groups such as yourself cited on what we're doing is really, really important.
Thank you, Rachel. Yes, I mean that'd be good. We have got to go with the recommendations. If any further questions for Rachel before we? Oh, sorry, Jonathan.
Thanks, Chair, and good afternoon, everyone, and Happy New Year. Apologies that I'm joining this meeting late. There were 2 points. The one's been dealt with already very nicely by what Councillor Guilfoyle raised, and Chair, you've just agreed to in terms of getting an update from the Mental Health Executive Group more around timescales and progress, so that we can be specific about that. The other point was, well, I suppose to note the breadth and the weight of the comments that have been made, which in a sense reflects the wide scope and the strategic importance of the chapter itself. What we do find with JSNA chapters is that we have to draw the line somewhere, otherwise they become encyclopedic and we never actually finish the chapter. So with your agreement, Chair, and that of Board, what I would propose is that the comments that have been collected, if you would be prepared for us to take a look at those, some of them I think might be very easily incorporated without a lot of work. I think other things which are very important and shouldn't be lost just need to be captured as items for further consideration, or at least items that were raised by board members at the point of signing it off, so that they're not lost.
Yes.
And that we're able to pick those up again in the future. If otherwise, I'm afraid that we might be bringing this back again and again for another year before signing it off.
I agree. So the recommendations are to approve the emotional and mental health of children and young people's joint strategic needs assessment chapter. Could I have a seconder for that, please?
Certainly.
Thank you.
Yeah.
Thank you very much indeed. Any objections to that? I think the point you've made, Jonathan, is that we don't lose any of the information that's come out of today's meeting, which is, they've all been really, really good. And thank you all for your input in that. So thank you very much indeed. We now move on to, it's good to have you back, Jonathan. I don't know, I mean, I was going to incorporate in my chair's briefing an update of where we are with COVID-19, the vaccine, etc. I don't know if at this point, while you're back in, could you give us on the work programme? Yeah, we can leave it till, yeah, are you okay for that to follow on after we've done item 7, Jonathan? Right. Are you still going to be around? And
Yeah, I'm around now. Yeah,
you're stopping with us, right? Agenda item 7, to update the Nottinghamshire Pharmaceutical Needs Assessment. It's Amanda Fletcher, consultant in public health, will give an overview of this item, and this will include an update of the pharmaceutical needs assessment and recommendation to amend future reporting on supplementary statements to the Health and Wellbeing Board. Thank you, Amanda.
Thank you, Chair. So yes, this is a much easier to digest and light-hearted paper compared to the previous 2 that we've spent a lot of time discussing. So the board will already be very familiar with this type of report due to us reporting this on a regular basis. But this paper is slightly different because we are seeking to propose a different way of getting your approval for such supplementary statements in the future. So 2 purposes of the report. We do need to approve the formal publication of a supplementary statement for quarters 1 and 2 of 2021. So that's any changes to the pharmaceutical needs assessment on services from April 20 to September 20. And then the second purpose of the report is that we would then like to propose a new way to produce these statements on a quarterly basis and include those in the Health and Wellbeing Board's chair report. So just some background information for you all. So the PNA describes the available pharmaceutical services across the county and assesses whether these services are actually meeting the needs of the population. As the PNA is governed by regulation issued by Department of Health, these regulations require us that we periodically issue and publish supplementary statements where we do not then need to do a complete review of the P&A, but it makes sure that that P&A is then as up to date and as accurate as possible. So, as I said, we're looking at the changes to services between April 20 and September 20. So that's for the first 2 quarters of the year. The majority of changes then relate to pharmacies that are changing supplementary hours, which this is those that are offered over and above the core hours of 40 hours a week. That's all captured in Appendix 1. You can see there's a few amendments in there. We also have had 2 closures of pharmacies during that period, and just so you're aware, no new pharmacy applications as well during that period. However, when we make an assessment, when we look at this supplementary statement, we can confirm that the pharmaceutical needs assessment does not identify any significant gaps in the services for the county, and these changes in these quarters do not impact on that assessment, which generally that tends to be the case when we're producing these supplementary statements. There would have to be some considerable changes for it to affect and make a significant gap into the services across the county. So what we are now proposing is that we take a bit of a different route and a more timely route for getting Health and Wellbeing Board approval for these supplementary statements. As I've mentioned, we're currently bringing it to board on a biannual basis. So we cover quarter 1 and 2 together, and then quarter 3 and 4 together. And we bring it as a formal paper to the board for approval, and then we publish them on Nottinghamshire Insight. Our proposal moving forward is that we then produce the supplementary statements on a quarterly basis so that they're more timely. We still publish them on Nottinghamshire Insight, and we share that information then with the Health and Wellbeing Board in the form of the update in the Chair's report. However, by exception, if we feel that a supplementary statement does identify a significant gap in the pharmaceutical services, we will then present a formal paper to the Health and Wellbeing Board. So that is our update for this supplementary statement and a proposal going forward, which is then the 2 recommendations that we're putting forward to the board.
Thank you, Amanda. Any questions, please? Councillor Creamer.
Yes, just a simple one. As I'm subbing on this committee, I'm not sure. How closely do we work with the city? I noticed that the nearest one to me, Carlton Hill, for instance, is just reducing its hours a little. At the same time, it's about 100 yards from the boundary of the city and the nearest to a lot of Bakersfield. And there's others. My personal one is actually in the city, not that one. So how close do we inform, the city that these things are happening? Because that does affect the city, the Carlton Hill one, quite a bit actually, because it's very, very close to the boundary.
So the legal requirements then for the P&As are per local authority area. So we actually have to make that assessment for ourselves, as do the city. But as you can also see in the report, we will be due to refresh both of our P&As for the city and the county in the future. And we do work very closely with them in revising all of that data and information for updating a full P&A. But absolutely, in that P&A, we assess kind of travel time and distance to pharmacies. That's part of whether we're meeting the population need. And people don't, kind of understand that we might produce a P&A by 2 different boundaries, but they'll cross boundaries and they'll attend different pharmacies. So we do look at that and share that information when we're working together to produce a P&A, but ultimately it has to be set in stone by each local authority area.
Yeah. Thanks for that.
Thank you, Amanda. Thank you, Jim. Any further questions? Sarah, is your hand up from before, or? No further questions.
Sorry, it must have been.
Sorry, my hand was up from before. Got it down.
Yeah,
sorry.
No problem. Thank you, Sarah. Thank you, Amanda. So no further questions. So the recommendations are to approve the supplementary statement to the pharmaceutical needs assessment 2018 to 2021 for the period 2020 until September 2020, and for all future supplementary statements to be produced quarterly and presented to the Health and Wellbeing Board in the form of an update within the Chair's report. Could I have a seconder for that, please?
Agreed.
Thank you. Thank you very much indeed. Any objections? Right, thank you very much indeed. That's agenda item 7 finished. Jonathan, could I call upon you to give a brief update on where we are with the COVID-19 and the vaccinations, etc. Thank you, Jonathan.
Certainly, Chair. I'll be fairly brief on this. So it's really providing a bit of local data which will complement, I think, what everyone will already understand about the national situation. So we're very familiar already with the measures in place now for the next several weeks, which reflect a couple of things. First of all, the rising rates right across the country, notably in London and the southeast and in some other areas too. It means that the England average rate at the moment, for context, is stands at 547 per 100,000. That's the case rate amongst people in the population across England, 547, and has been rising very sharply. And as you will have heard in national media, in placing very severe pressures on health and social care arrangements in some parts of the country. And in Nottinghamshire, we also hear from Andy Haynes, who leads our ICS, and from other NHS colleagues who will be on the call, the very severe pressures that health and social care, secondary care and primary care, and in our care homes as well, face at the moment. The situation in the county in terms of rates at the moment is that happily there is nowhere in the county just at the moment with a rate that is as high as the England average. So on the one hand, that's good. But if I just give you a little bit more local colour around that, I need to tell you that across all districts and boroughs, with the exception of Bassetlaw, there have really been some very sharp rises over the last couple of weeks or so. The steepest rise, as it happens at the moment, has been in Ashfield, and Ashfield yesterday had a rate of just about 500 per 100,000. So that rate is very high. Even if I was to look at the part of county at the moment, which I think is Newark and Sherwood, that has the lowest rate, the rate there is 277 per 100,000. Wherever we look in the county, the rates are high, and with the slight exception of Bassetlaw that I'll come back to in a minute, are increasing very sharply. And even in the most recent days, for which the data is incomplete at the moment, so we know the numbers will only go up, we also know that in those most recent days that don't yet appear in those headline numbers, the rates that will push higher again. Alongside that, I have to tell you also that the rates of positivity are high and have been increasing and are still going up. And that's also another indication that, if anything, the case rates continue to head in the wrong direction for the time being. I'll just make a comment briefly about Bassetlaw, and that's to say that Bassetlaw, if we cast our minds back a month or so, had higher rates than the rest of the county. Its rates then were around about 250 per 100,000 or thereabouts. And unfortunately at that time was sticking out in a wrong way, in an unfavourable way. Bassetlaw, its rates have moved around a little bit, but broadly they've been more or less a plateau compared with the rest of the county. I think today stand at 286 per 100,000, so haven't moved as dramatically as other parts of the county, but still remain at a level that is much too high, because we see these increasing rates right across all age groups, broadly speaking, and so it's still affecting older people and the groups of people from amongst whom we can expect there to be most admissions to our hospital, and most pressures are rising in some of our other institutional settings as well. So if I was to add a little bit more local colour to that, I was hearing at the outbreak cell today that across Nottinghamshire County, there were, I think, just over 40 care homes and residential care settings where there are active outbreaks being managed, and another 20 or so in the city. And of course, on top of that, we're also seeing fresh outbreaks now in some other institutional settings, including our prisons, in a number of workplaces and so on. And I'm afraid we're expecting that will continue to increase over the next little while. The final thing to mention, as I touched on before, is that if we break this down into different districts and boroughs, we see a slightly different picture in one locality to another, with some slightly different the increases affecting different age groups slightly differently, but broadly this is being strongly driven by people of working age, so those 18 to 59, which make up the bulk of our population, of course. Whereas we can draw out differences between one bit of the county or another, the advice applies right across the county. We need to double down on all of the control measures that we know and love so well, and that is what will stop the spread most effectively ahead of us having a vaccine. Then one or two comments briefly on the vaccine, and it might be my NHS colleagues might want to join in at this point. But that is to say that other vaccine delivery sites are starting to come online. And as they do, I know our NHS colleagues are eager to publicise and to make those really clear to councillors, board members and residents. But they are equally cautious about making public those details before they're actually in the bag. So I'm not going to go into further detail around that now, other than to say that there are good plans in place to make sure that everyone who's over 80 and residents in our care homes and staff as well, I think will be vaccinated over the course of this calendar month. They have good plans in place so that Nottinghamshire can fit in with the same sort of trajectory that we hear the Prime Minister talking about, so that we can make sure that vaccinations are completed to those groups that are of highest priority over the next 6 or 7 weeks. I hope that's sufficient. There may be NHS colleagues on the call who wish to bring some granularity to that, but that's in outline is the situation.
Thank you, Jonathan. I mean, my phone's been going mad all afternoon regarding the over 80s being advised to wait until they're contacted, and yet there's all these slots available on Swift queue, which is causing mayhem all over the place.
So I can clarify that, and I've had it confirmed to me earlier today, that when a member of the public who's invited, who is eligible and is invited to go onto the site, is able to scroll through and to see that there are a number of potential slots available, that may be the case at that point in time for that individual. But I can assure board members and indeed residents that local NHS is working really well to fill all of those slots. And it's not a case that vaccines are going, if you like, wasted and undelivered as a result. And I think that's probably the key thing to note. So whereas there'll be an enormous appetite from across all our residents for understandable reasons, NHS are working really hard locally to make sure that we're making optimal use and as soon as possible.
Jeremy.
Yeah, I just reinforce what Jonathan says there in terms of the vaccination programme. The message that the party line that we're trying to hold in the NHS is that we will invite you. Now, unfortunately, and for various reasons, there have been leakages of booking systems onto into the public domain. There have been there were 2 leaks that came out of NUH, and there was 1 leak that came from 3 MPs who posted letters that patients have been provided with on their Facebook sites. There obviously have been conversations with regard to these issues, but they do create huge amounts of problems for the people who are trying to manage these incredibly complex systems. We've never had to deliver vaccination programs on this scale. It is important to know that what is happening is that vaccination programs are being targeted at the individuals who are at the highest risk of death from this virus. and so the older age groups are being targeted first. Also, people who are working on the front lines as well, who are also being exposed to higher amounts of this vaccine. Obviously, our care home patients, where Jonathan has sadly reiterated that there are increasing outbreaks with higher prevalence rates of the virus. But the message is really important. You will be contacted. We will be delivering the vaccines in accordance with the vaccination committee's cohort priorities. A number of sites have started to open up in the community. We have now, and those are for mainly around the Pfizer vaccine, but the AstraZeneca vaccine has got approval, and so we anticipate that in due course that general practices themselves will be used to vaccinate more and more patients. There is a meeting on Thursday with regard to that the primary care teams are going to be advised about. And I understand around the urgency, but we do need to try and keep some order to the system as well. There are significant numbers of vaccines that are being delivered on a day-by-day basis, and the numbers are growing. So I think what is going to be really important, and it's interesting, I've got a meeting about this afterwards, is there's still a significant number of people in our populations who are uncertain about the vaccine. And I do think there is a necessity for the communications teams in the CCGs, local authorities, to actually start having conversations about how we're going to deliver messages about the vaccine. Because if we don't get the population vaccinated, as we've seen, the tools that were initially used in the first wave of the social distancing, hand washing and lockdown only work temporarily. And we're going to get more and more outbreaks and more waves, which have secondary impacts on on terms of things like mental health, on our economy. We have to get this vaccination program rolled out at scale. And we've got to start thinking outside of the box, not just telling people that it's available, but actually influencing the people who are uncertain. And I hope that there will be more around the communications around this vaccine, because the local authorities were excellent the first time around getting the messages out there. But I think we do need to be thinking outside the box and how we're going to influence people as well.
Thank you, Jeremy. Henry.
Hello. Yeah, I just wanted to make you aware that actually in the Gedling area there's been a fake NHS text messaging service being flitted around, and we've made the police aware of that. We've also raised it with the Neighbourhood Watch teams, but there are some fake NHS websites circulating saying that you can obviously book your vaccine when you can't, and also there are people going around ringing people, book your vaccine and then get money off for vulnerable people, which is absolutely disgusting, quite frankly. So there are things that we need to be aware of. There are criminals out there operating at this very moment, scamming vulnerable people, but also underwhelming. They're basically undermining the system with these fake sites and stuff. Secondly, I'm just going to come back to schools again. Sorry, you might not be able to answer this question, but obviously this comes back to staff welfare. In schools, there were cases constantly throughout the autumn term. There were cases every week, every day, some cases, sometimes 3 cases a day. One of the questions that staff have been asking union representatives, including myself, is why is there no noise in the national media around vaccinating frontline school staff, and not just teachers here, because I know teachers get mentioned quite a lot, but frontline school staff that are working with vulnerable children right now, and with key worker children, There's no mention around vaccination for people, particularly in the school settings. But also, we've been told there's going to be testing in schools. Well, I'm yet to see any testing in schools in my area. There's none. I'm yet to see it. So I haven't got a clue what's happening. Schools are operating in the dark, it seems sometimes, and they're just, why wasn't the testing done? I know I'm going to ranting on a bit here. Why wasn't it done way back in September? Staff are really angry, getting angrier. You might not be able to answer that question. It's just one I wanted to raise. Thank you.
Thank you, Henry. Hazel.
Hi, I just thought it'd be helpful to clarify that we've had 4 local vaccination sites that have gone live or are going live this week as we speak. And just so that people are aware, so it's the Richard Herod Centre in Carlton, it's Cripps in Nottingham City, Ashfield Health Village, and Gamston Community Hall, which is going live this afternoon. And it's just to really pick up on Jeremy's point about the over 80s is the priority group, and that they will be written to with a letter just confirming actually how they need to book on, and there's instructions firmly within that letter as to what those actual patients need to do. And also, just to also make you aware, we've had both Pfizer and AstraZeneca vaccination delivery confirmed for all those sites for this week.
Thank you, Hazel. Neil.
Thanks, Chairman. It's just picking up one of your points, Jeremy, actually, about the message, getting the message out about the vaccine. I've just been trained as a volunteer vaccinator myself, and part of the NHS e-learning was some modules on the vaccination or the vaccine research, development, and the production. So we've all we've had modules that enable us to tell members of the public how effective, how it's being developed and the efficacy and how safe the vaccines are. What you're saying is exactly the point about people who are concerned about the vaccines. Is maybe if the NHS as a whole could get some of that information out into the public domain rather than just saying the vaccine is here.
Yeah, thank you, Neil. I think this was just an update briefing from Jonathan. So thank you, Jonathan. Thank you, Jeremy and Hazel, for the updates. I'm sure we could go on all afternoon with different points. Thank you. Oh, Idris. Sorry, Idris.
Yeah,
you've not come from my screen.
Thank you. Just really briefly then, like I say, I think we've covered most of the points. From a Bassett Law perspective, our first site went live just before Christmas, and we've got another one who's received their vaccines today. So by hopefully next week, subject to good supply of the vaccines being delivered, we'll have sort of comprehensive coverage of the vaccination programme across Bassett Law. But we do need to bear in mind that we've got a considerable number of people to vaccinate, and it will take time. And just to reiterate, it is really important that people wait to be called, and they will be. And if they're over 80, it'll be pretty soon, hopefully.
Thank you, Idris. I think we all seem to be. I think we've got a common denominator where we're struggling with the communications on all aspects of it. So I think we need to work better on that from all aspects of the vaccination and the rollout and the security of it, etc. So thank you all very much indeed for your updates, and thank you, Jonathan. Agenda item 8, the work programme. The recommendation that the Health and Wellbeing Board's work programme be noted and consideration be given to any changes. As members are aware and seen in the media since we last met, we've entered a third national lockdown. These challenging times continue to demand significant resources from our respective organisations, and people are so busy now dealing with the important issues. The next time we meet will be Wednesday, the 3rd of March. And as with the current meetings, it will be virtually. So, yes, so the workshop in February will be cancelled to allow people to get on with their very important roles that they're doing now. So I think it's been a very good meeting, and thank you all for your input today. It's been and all the inputs have been taken on board. So thank you all very much indeed. Again, I'm wishing you all a very happy and healthy new year, and thank you all for attending, and thank you mostly for your input. Thank you very much indeed. Thank you.
Thank you, Chairman.
Can I wish everyone in Nottinghamshire a very happy 2021? Some of you might be making New Year's resolutions today. Can I encourage you to resolve to double down on all of those measures which are going to keep you, your family, and people that you don't know at all safe and well in 2021? It's by reducing our contacts with other people. It's by keeping going with the frequent rigorous hand washing. It's by maintaining the social distancing. It's by making sure that we get a test really promptly and isolating if we have symptoms, that we keep ourselves, our families, and those around us safe in Nottinghamshire. Thank you for your help with that.